Medical experts have called on the federal government to help fund research to prevent and curtail the spread of epidemic diseases. This call was made by the Vice President of Medical Laboratory Scientists Southwest, Abiodun Hamzat, during the investiture of the new executive of Oyo State Council of Medical Laboratory Scientists. Abiodun Hamzat attributed the lack of progress in healthcare delivery to several factors, including inadequate funding, insufficient manpower training, poor remuneration, inadequate laboratory equipment, and insufficient empowerment of professionals. The newly inaugurated chairperson of the Medical Laboratory Scientists Oyo State Council, Akimbile Adebola, appealed to Oyo State government to establish a medical laboratory directorate at the State Ministry of Health to enhance diagnosis, treatment, and awareness of diseases in the state. She advised residents to visit recognized hospitals when experiencing symptoms of illnesses and seek professional laboratory testing when necessary.
All the research we've been doing, our people are doing research on a daily basis. Unfortunately, our own government has not been funding our research. Most of the research are self-funded, or probably we ask for grants, from international community to fund such researches. But for us as professionals, a lot of us, we do self-funding, which is laborious, which is not easy for our colleagues to do because the heading power has already gone down. And when you begin to fund all these things on your own, it takes longer time.
For instance, in some states, we are yet to have medical laboratory scientists at the Ministry of Health. One of the examples is in Oyo State. We are yet to have a directorate at the medical laboratory directorate at the Ministry of Health, because this will enhance diagnosis, the treatments, and the awareness.
The Adamawa State government, with the support of the United Nations Children's Fund, UNICEF, is planning to immunize approximately 1.4 million children to strengthen their protection against polio. The partners issued an urgent call for parents and guardians to participate in the upcoming polio eradication immunization initiative, which is both free and effective. Bashir Saidu, Executive Secretary of the Adamawa State Primary Healthcare Development Agency, along with Olusheyi Olusunde, Health Officer at the UNICEF Bauchi Field Office, emphasized that the immunization exercise is scheduled for April 26 to April 29th. This initiative is part of a national effort designed to enhance the immunized system of children aged 0 to 5 years. The federal government, under the guidance of National Healthcare Development Agency and the Ministry of Health, has directed all states to conduct a nationwide campaign for polio eradication to ensure that every child receives the appropriate vaccination according to their age. Although current data indicates that Adamawa State is polio-free, officials stressed the importance of implementing precautionary measures to maintain this status.
Our structure through the areas, the chiefdoms, through the district heads, the mayor, village head, and the ward head. This is another structure that we are using. Are we together? And before we do the campaign, we meet with them at state, LGA, and ward level, and they will do the engagement. So to be candid, even if it's not in Nigeria, if it's in Adamawa State, we are 100% responsible for it. We want to make sure that all their children, their wards, their neighbors, their grandchildren are vaccinated.
Every child is fully immunized. For Nigerian government and Adamawa State government, the commitment is not just polio campaign. The commitment is to have a strong routine immunization system that ensure that every child is given appropriate vaccine according to their age.